I'm not sure what time of the day you're watching this, but I want to talk about a topic that is prevalent in dental offices, which is working through lunch. I've been in a lot of dental offices and I know what it's like where the day just gets going and going and going. And next thing you know, we're working through lunch. We barely get a chance to eat. Everyone's running around, they're exhausted, and it becomes a typical thing in the dental office. I want to talk about why that happens and why it's important to try to avoid it if possible. So, typically, what I think happens is dental offices work, and dentists and teams, we work to fill the schedule. Wherever we can get a patient in, let's get them in. And a lot of times we have emergencies and we're trying to squeeze them in, and there's time over lunch. So, what I find in a lot of dental offices is either we don't book enough time for lunch, or we run behind because we're not in control of our schedule, or we put emergencies in over lunch. And next thing you know, we're starting at 7 or 8 in the morning and we're pretty much going nonstop till 5 or 6, which turns out to be, a stressful day. Everyone's exhausted and a lot of burnout. So I'm a huge advocate of taking lunch, which is funny. It should be something that's standard, but it's not. And if you're a doctor, I kind of want to talk to you about this specifically because doctors, I don't know, you guys don't need to eat lunch or something. I'm not really sure, but the rest of us do. So here's my reasoning and suggestion about lunch. I think that you have to put a block in. You have to put lunch in your schedule every day. And there's multiple reasons for that. And I say this because I think people put in a lunch, but they don't put in enough, or they don't respect it enough, or they don't block it, or they stick emergencies in, and then it just becomes habit. Here's my thing. I think you need to have a lunch every single day, and there's a couple reasons. First of all, everybody on the team deserves to get a break, okay? In the state of California where I live, you have to, right? But everybody deserves to get a break. We're working high stress jobs. We're exhausted. We need to eat. It's healthy. We're going to be better people if we have lunch. If we get a break, we can get out of the office, get some air, whatever. So it's more important, or it's most important, I think, that we get a lunch just for a healthy team and a good environment. But secondly, scheduling a lunch is also important because many times, or sometimes, we run behind in the morning. Things happen, instruments break, patients run late, and if we have the nonstop day with not a big enough lunch and patients, things run behind, we're going to run right into the afternoon schedule and never get that break. So I like having a lunch, a 1 hour lunch in the schedule every day, because not only does it give us a break, secondly, it helps us get back on schedule in the afternoon. If we're having one of those mornings where it's just insane, I want the opportunity to catch up, right? To breathe for a minute and then have the afternoon start on time. So that's my second reason. And then thirdly, even if we schedule an hour lunch, we don't get an hour lunch. By the time the instruments are done, the rooms are turned over, we've taken turns answering the phones, we've put our notes in, we're lucky to get 30, 40 minutes max. So putting in an hour lunch gives us a little bit of a breathing room, quote unquote, so that we can not only catch up, have a few minutes to eat, and honestly, it's just a good practice. And actually, it's legal. You have to. If you're working 8 hours days, you've got to give somebody a break. So get in control of your schedule. Most of the reason we don't have lunch is either we're trying to fill in too much production. That's how we're trying to fix the practice. So if that's the case, you need to get my book, Step Away from the Drill, because I'm trying to show you that fixing your practice it's not going to fix by just shoving production in. Secondly, you need to have a scheduling policy. So you need to have a policy around, do you see emergencies at lunch or not? And that's dependent on your office, but it's my suggestion you don't. And then thirdly, you need to get in control of your schedule. So many practices are kind of just letting the schedule run them. You walk in the morning and you're like, oh, this is going to be an awful day. Okay, go, right? Get in control of your schedule. Learn how to build a productive schedule. Learn how to build a schedule that you're going to hit your goal every day. Everybody gets a lunch and we get out of the office on time at nighttime. And I'm not saying it's going to happen every single day, but the majority of the days you should be making sure that your team has lunch. If you really want to build a culture that's great, if you want an environment where people get along, where there's not a lot of stress and they can breathe and be healthy and be good, make sure that you're scheduling lunch. So that's my suggestion. If you're a team member watching this and your office is not necessarily great at that, then definitely bring this to your doctor and we can help you at Front Office Rocks. Productive scheduling is the way to do it. You need to be in control of your day which allows you to get lunch every day. So on that note, if you watch this in the morning, go get lunch. If it's at lunchtime, hope you're enjoying it. And if it's in the afternoon, plan for your day tomorrow, because I think it's vital and important. Please subscribe below. I would love to help with other tips that we have, other suggestions. And I'm getting a lot of comments from other offices and questions. So send them my way, and it gives me great content to talk about. And I love doing this. So thank you guys for joining me again today. Go get a good lunch, and I'll see you next time.